Hello everyone. So this is the first of a number of videos on chest x-rays. In this x-ray, we're looking at a feature of incorrect nasogastric tube placement. So this was a male patient who presented to the ED with abdominal trauma, the cause for which is irrelevant to this x-ray, but because of this abdominal trauma, he required a nasogastric tube to be inserted. So a nasogastric tube is a tube which is passed through the nose and passed down the esophagus, intended to reach the stomach, which is in this area here. Um, Through this tube, they can deliver the nutritional contents that are required when the patient is unable to feed orally. So normally the tube, as I mentioned, would be coming down the esophagus up to sort of this point, where it would then pass through the esophageal sphincter and junction into the stomach, which would be sort of positioned here below the diaphragm. So actually it would come down quite low, probably to this point. However, in this image, obviously we can see that the nasogastric tube, as it descends, actually enters a region that is not below the diaphragm. So in this patient, the nasogastric tube was actually inserted through the nose, but then went into the trachea, and then it was passed into the right main bronchus, eventually to end up in the right lung. And that can be seen here because we can see that this darker area in the middle is the trachea before it splits at the carina here into its right and left main bronchus. And the nasogastric tube follows that path down into the right main bronchus and into the right lung lobes. So this is obviously incorrect positioning of the nasogastric tube and would have quite severe consequences if the tube was started to be used for nutritional feeding of the patient. If food contents were to enter the right lung, this could potentially cause severe lung parenchymal irritation, subsequently leading to pneumonia. So this nasogastric tube would obviously have to be taken out, but the X-ray really demonstrates the importance of imaging once the nasogastric tube has been inserted in order to check for its correct positioning before it can be used.